He said, I need to do a rather aggressive treatment on you. Do you have a wife and children? If so, we need to call them and tell them, we need to essentially tell them goodbye because you have about a 20% chance of surviving this.
I can't even imagine. I mean, is it hard to talk about?
The hardest part of all to remember is the phone call to my wife and kids. I mean, that was just awful.
What started as a cough and a fever ended with 49-year-old Michael Herbert in the ICU on a ventilator for 7 days, unsure if he'd ever see his family again.
I didn't know what was going to happen, if I was going to wake up or not.
In all the numbers we hear about coronavirus, number infected, number who have sadly died, we haven't heard as much about another group of patients, those who have recovered.
There are more than 1 million people that have recovered. Many people are doing very well. There may be some individuals who will have some long-term effects because it depends on how severe the virus was.
How are you doing? What does recovery mean for you?
When I first got out of the hospital, I was very weak, and I'd been told by the doctors, the pulmonologists in particular, that my lungs would probably take 4 to 8 weeks to heal.
Was that a concern that you might have long-term impacts on your lungs?
I can tell they're not 100% right now, and I guess I shouldn't expect them to be. They told me it would be a while for them to be all the way back. Again, just like everybody else, I think there's a lot of unknown here.
There are still a lot of unknowns. And even studying recovery of coronavirus patients seemed like a luxury in the early days of this pandemic.
Today is pretty intense.
But now Dr. Reynold Panettiere is trying to decipher these unknowns by conducting a 6-month study of coronavirus patients who have recovered.
There's several cases and participants who've described this ongoing fatigue and malaise, a feeling of not well. What is curious is these patients, pre-morbid or prior to the infection, were even aggressive athletes. We would not have predicted that.
One thing that could help predict long-term effects is looking at what happened during other coronavirus outbreaks. Take a look at this. Those are fibrous stripes on the lungs. It almost looks like spattered paint. These could be an early sign of pulmonary fibrosis. That's a type of scarring of the lungs. Previous studies of coronaviruses like SARS and MERS have identified patients who had long-lasting fibrosis. And now we are seeing reports of COVID-19 patients with these same fibrous stripes on their CT scans. It's another example of what we're still learning. From infection to recovery, we're still not sure exactly how this virus will truly affect us long term.
It's 6 weeks since you were, quote, off the breathing machine and in the process of recovery. How are you doing 6 weeks later?
I'm doing so much better. When I finally got to see them again, eventually, once I was taken off the ventilator, it was like the best thing that ever happened.